Hi, my name is Bob Mazey, and I'm the president of the New Jersey Agents Alliance. And thank you for joining us for another edition of our ongoing series of key interviews with thought leaders in the insurance industry. Today, I'm pleased to introduce you to Michele Burke from Alliance Benefit Solutions. Welcome, Michele.
Thank you.
And today we're going to try to, in about 10 minutes, demystify some of the rumors, some of the frustrations with health insurance in New Jersey. So, Michele, let's start from the top. You know, you deal with a lot of employers, both new employers as well as existing employers.
Yeah.
Most companies seem to have health insurance for the most part, but not all. Mm-hmm. But what do you run into when you see a new client or an existing client? How do they feel about their benefits? Do they really understand them? Are they happy paying the bill? It's funny with property and casualty insurance, auto, homeowners, business liability, the hope is they'll never use it.
Right.
But with medical insurance, there is really this sort of expectation. It seems kind of weird, but you almost want to get sick or you want to get hurt in some bizarre way to make sure that you have good health insurance and it's paid for and so on and so forth. So to that end, tell me about the typical perception of health insurance and what people think they have.
So it's funny that you say that because that's probably one of the remarks I get all the time is that an employer will say to me, I spent all this money and I never used my health insurance. And I'm like, well, that's a good thing.
Mm-hmm.
It's not a bad thing.
Right.
But most people do use their health insurance, right? So it is more personal to them. I think the biggest thing that I hear from employers, obviously they're not happy with the rates. I don't think anybody's ever happy with the price that they're paying.
Mm-hmm.
But when I try to dig more into it and when I'm talking to an employer, I need to know what they have, before I can help them. And you wouldn't think that's a tough question, but a lot of employers don't realize what they have. They know they're paying too much, but they don't really know what they're paying for. So that's something that, once we start digging into it, that we find out a little bit more about what they have.
Right. So interesting point. So they're paying for it.
Right.
They really don't know what they have. That probably leads to some frustration or disappointment, if you will, in paying that bill. So where's the fault line? What happened when a client doesn't understand what they have? Is that the broker's responsibility? Is it the employer's responsibility? Is it the carrier's responsibility? Is it the employee's responsibility?
Yeah.
So who's responsible to make sure that the customer and the employee understand what they have?
Yeah, I mean, it's, I'm sure there's enough responsibility to go around, right?
Mm-hmm,
But I think the important thing is employers offer health insurance because they want to attract, right, and maintain great employees.
Mm-hmm.
So it's something that they're offering it's a good thing, right?
Mm-hmm.
And then you get inside and you start talking to the employees and they don't know what they have and they're frustrated. So it makes like a really positive thing negative.
Mm-hmm.
So who's responsible? I mean, I think that communication is key.
Mm-hmm.
And I feel that's probably the biggest problem, right? Because I talk health insurance all day.
Mm-hmm.
So for me, I could look at a plan and I know what's in it.
Mm-hmm.
But to most people, they don't. So, and until they're using it, that's when they start to realize what they have. And sometimes they're using it the wrong way. So it's really good to be educated on your plan. So how do you do that? I mean, the employer needs to provide that communication. Mm-hmm. Employees need to read it, right? Mm-hmm. And then you need somebody maybe to make it easier for them and who's maybe experienced and can help them really take that information and simplify it.
Gotcha. So on the topic of the cost, I think we all believe that, the costs are too high, but can you help us understand why these costs are the way they are? It seems like, with any other commodity and thanks to things like natural disasters, the cost of lumber's gone up. Thanks to COVID, there's been additional, safety protocols that businesses have had to adopt. So what's really behind the curtain in why health insurance is so expensive?
Gosh. Yeah, I'm going to try to simplify that. I guess to your point, what will happen a lot is an employer will tell me about the guy down the street who's paying half of what he's paying, mm-hmm. right? So with small group under the Affordable Care Act in New Jersey, and every state's different, but it's age banded. So
Okay.
you're going to get charged based on your age.
Okay.
So what makes up the premium? Well, the carriers have underwriters, right? And they're really good at what they do, so they can kind of figure out where the rate should be. But it's really based on claims, right? So we have to have, if you have $1, 80 cents has to go towards benefits. So, the rates can go up and down based on how the small group, I'm talking small employer, how their book is running. But, there's a lot that goes into what's covered. So we have a lot of mandates in New Jersey. There's a lot of, healthcare and technology just keeps getting, more and more expensive, right? So people are living longer. There's just a lot that goes into your healthcare costs because we're keeping them alive because now, there's so many hospitals have so many different costs and they're really expensive. So a lot goes into it, but just to keep it simple, it's really based on the claim of that carrier's book of business.
Gotcha. It's funny you mentioned hospital cost. Just about a month ago, as you know, I recently moved, and the movers didn't take everything. So I had to move some things myself.
Oh, no.
And as I was moving our outdoor patio furniture, I wrenched my back pretty bad to the point where I had a hard time walking. So we just thought we would go to the local emergency room.
Yeah.
And I did go to the local emergency room. And basically, in a nutshell, I strained my back. I had an X-ray, and they gave me a pain medication for the day. But I got the bill. It was $8,000, and I was only there for about 4 hours. So I'm thinking to myself, boy, I'm glad I have health insurance.
Yeah.
But when I ended up submitting the claim, I noticed when I got the statement back from my health insurance company, that $8,000 bill was negotiated down to a lower number. But, we can get into that another time. But, $8,000 for 4 hours just seems like an awful lot of money, and someone's got to pay that, right?
Right. And to be fair, because I get it, right? I pay for health insurance for my people. And I don't love it, right? Nobody
Right.
loves to pay the bill. I get it. But to be fair to the carriers, they're also, so if somebody goes to the ER, sometimes they have no control over that claim, right?
Right.
Different than if somebody's staying in network.
Right.
So again, that's part of the education process. If something like that happened, we would, and you called me because I'd pick up if you called me.
That's great. That's great.
I would probably recommend you go in an urgent care, right,
Okay.
instead of the ER room. But with that said, yeah, costs are out of control, and there's enough fingers to point on who's responsible for them, right? But for me, when I'm sitting with a client, I honestly just want to find out what they need it for, what they're using their insurance for, and try to come up with the best plan for them.
Gotcha.
And then once we do, then we try to help them communicate that.
Right. So when you visit with an existing client that has group insurance, are there any common mistakes that the current broker may have made, or any common oversights that you think that the current provider may not be delivering from a service standpoint or from a consultative standpoint to the client? Do you see that quite often, or what sort of things do you see that
Yeah.
clients are upset with?
Well, I think one thing that we're conditioned to always want the best, right? Like we want the best. Sometimes we don't want to pay for the best, but we want the best. But what does that mean? Like, what is the best to an employer, right? So the best to them sometimes is having a plan with no deductible. Everything's covered at 100%. They're paying their, $20 when they see the doctor. They don't want to pay anything else. But their premium is huge. And, that might be really good for the employer. Maybe he has some kind of medical conditions that's necessary. But then I go in the back and I meet his team, and they're young people who, when I talk to them, don't use the coverage. So he's paying a big bucket of money for something they're not using. So
Right.
I, try to talk to them about setting up maybe a reimbursement, like an HRA or something, where when the claims are being used,
Okay.
that he can reimburse them. Because premiums are coming every month, right? You're definitely going to pay your premium, but you're not definitely going to use your coverage. So it's really a balance to try to figure out how they use their coverage. It's remarkable how many people just feel like the most expensive plans are the best for them.
Right. So, Michele, how would someone reach out to you to learn more about your services and Alliance Benefit Solutions?
I love to be a resource for people. I've been doing this for over 20 years, so I just love to be a resource and to help anyone who needs help. Obviously, I'd love to make them a client, but I am here to help. So I guess email or cell phone number would be the best way.
A website?
Or our website.
Yes, and your website address?
www.alliancebenefitsolutions.com.
That's
It's a
great.
little long, but
That's fine. That's
Type it in.
great. Well, super. Well, Michele, thank you so much for taking the time
Thank
to
you.
to talk with me this morning, and thank you for listening to this session of our ongoing series of conversations with key thought leaders in insurance. And we look forward to seeing you again. Thanks for watching.